The concept of cellular senescence opens up a new important opportunity for addressing clinical approaches that might, in fact, be the most important approach to maintaining our health as we age. Hi, everybody. This is Dr. Bob Hariri from Piloting Health. And today I'm going to talk about a topic that is becoming increasingly important to me, increasingly important to the scientific and clinical communities out there who are addressing age-related diseases and the consequences of declining function as we age. And it revolves around a very important scientific concept called cellular senescence. Now, cellular senescence means that over time, healthy, functioning cells can begin to lose their steam. And what I mean by that is they can begin to wear out to a point that they no longer can divide. Their synthetic behavior becomes erratic, and they begin to function in abnormal ways that lead to some of the diseases that we fear the most, things like cancer, even things like degenerative diseases that lead to arthritis, liver dysfunction, and important to all of us, cognitive dysfunction as well, not being able to use your brain the way you used to. So let me take a couple of steps back and get you grounded in the whole concept. So just like in life, everything doesn't last forever. Living healthy cells don't last forever either. And in our lifetime, as I've said previously, but I want to repeat, you may be made up of 25 or 30 trillion cells. Each of those cells originate from that single cell that's created during fertilization, gives rise to the developing placenta and fetus, and ultimately populates your body as a newborn, and you carry those cells with you throughout your lifetime. Now, we go through a process of renovation and renewal throughout our lifetime where, as a consequence of injury, as a consequence of illness, or just as a consequence of aging, some of the cells in your body have to be cleared away and eliminated because they become senescent. That loss of the ability to divide and that loss of the ability to have normal synthetic function has major consequences in your health, among which is the loss of some of the important chemical signaling that takes place between your organs and tissues and leads to a decline in the function of that particular organ or tissue. So, for example, senescence in the kidney causes declining renal function, and that prevents you from clearing things in your kidneys, and that's an important part of the excretory or the excretion process, which keeps your blood clean. Likewise, that same process in the liver will impede your ability to metabolize certain things, not just nutrients, but even metabolizing toxins and poisons. So the concept of cellular senescence opens up a new important opportunity for addressing clinical approaches that might, in fact, be the most important approach to maintaining our health as we age. So let's get into more detail. One of the most important biological processes to maintain health, disease resistance, and productivity is the process of pruning. So for those of you who grow roses, or for those of you who have fruit trees, or anybody who's got is an amateur gardener or a professional farmer, you know that in order to maintain season after season the health and productivity of your products, of your agricultural products, you need to, every end of every season, prune away the dead, damaged tissue, whether it's the branches on a tree, whether it's the leaves on a rose bush, whether it's the flowers on a rose bush. You've got to remove the old dying material to make room for new growth. Now, pruning is a process that takes place in our bodies as well. And the way that that works is that cells that are past their prime or senescent happen to be much more susceptible to expressing certain molecules on their surface that are called stress ligands or stress antigens. These are abnormal proteins which signal that the cell is due to be cleaned up. The process of cleaning up that cell is the same process that is responsible for virally infected cells to be cleaned by the immune system and even cancer cells from being cleaned from the immune system. This common denominator of what I would call cells that are out of their prime and potentially dangerous is a basis for using other tools to accelerate or enhance the clearing of those abnormal, dying, or defective cells. And I like to think of that as a form of cellular pruning. So the way you prune these abnormal cells is one of the great potential opportunities to address diseases of aging, cancer, chronic infection, etc. So let's talk a little bit more about that. Many of you know that we have been working at Cellularity on cellular medicine, cellular therapeutics that use part of the immune system to specifically target threats to our health. In some cases, those threats are cancer cells, and we've used natural killer cells derived from the placenta to enhance the clearing of those cancer cells and reduce the possibility that they will begin to grow, take root, and become a real malignancy or tumor. We've taken the same natural killer cells that are part of our innate immune system, and what that means is that these cells come kind of pre-programmed to do their job, and we've used those cells to enhance the clearance of virally infected cells. Back when the COVID pandemic was at its peak, we actually took our natural killer cell product, CYNK001, into the clinic with the FDA's endorsement under what's called an IND, an investigational new drug application, and we treated COVID patients with these natural killer cells. And what we saw was that not only could they be administered safely, but they could actually enhance the clearance of some of the COVID virally infected cells that were participating in the illness and the progression of the illness. So this is a tool, this is an approach that is already fairly well accepted in medicine. It's our job to find ways to provide these tools so that they can be deployed in a broader number of applications, such as part of an overall strategy to address the diseases of aging and to enhance the quality of life and health span in the longevity-seeking community. You know, personally, to me, it makes kind of intuitive sense that if nature already created a tool that goes after senescent cells, why not just amplify that by providing additional types of these natural killer cells or using them in the right clinical setting in order to help reduce the possibility that those senescent cells will lead to cancer, will lead to a degenerative disease, or get in the way of the natural regenerative processes which keep us young. So I'm here to tell you that personally, I think the objective that we have clinically using a natural tool like the natural killer cell is going to give us an opportunity to perform something that I call seno-ablation. Seno-ablation means the elimination, the cleaning up of senescent cells. Think about it as no different than pruning those dead branches off your fruit trees, taking those dead leaves and dead flowers off your rose bushes so that that particular regenerative process can restore the health and beauty and productivity of those flowers, trees, and in our bodies, in our organs and tissues. And so seno-ablation is going to become an increasingly important topic in the field of maintaining health, improving health span, and maintaining quality of life as we age. The other thing which is interesting, if you think about it, is that seno-ablation, since it's going to make room for new healthy cells, and those new healthy cells are going to come from either your own stem cell population, which is going to divide and specialize and repopulate the newly pruned organ or tissue, you could actually kind of imagine that there may be strategies where first you use natural killer cells as a seno-ablatant to get rid of the senescent cells and make room, and then you follow up with introducing new stem cells that can repopulate your organs and tissues and restore functionality. So I bring this up because there's a logic behind all this, which is to attempt to preserve and restore function as we age by using nature's own mechanism, using natural killer cells to clean out old senescent cells. We're just finding ways to amplify, augment, enhance that using cellular therapy tools. So now that I've kind of set the stage here, let's talk about how important the process of clearing out bad, malfunctioning materials or mechanisms or cells, or even in airplanes. I'll give you a great example in aviation. One of the reasons aviation is so incredibly safe, and it's something a lesson that I learned that I like to pass on medically, is that that some important components actually have a lifespan, and that lifespan is exhaustible. Hydraulic pumps that pump your hydraulic fluid in an airplane, pumps that pump your fuel in an airplane, actuators which allow you to control the control surfaces, the parts of your wings and your tail which allow you to steer the airplane. Those components wear out. Now, in aviation, we figured out what the kind of average lifespan of those parts is, what the useful life is, and we create two processes. One, a process of inspection. We look at them to make sure that they're functioning and they still have some useful life. But we also have scheduled replacement where we actually get rid of those parts before they fail. That's why airplanes are so incredibly safe, because we take steps to preempt problems, to prevent problems from occurring by understanding the natural lifespan of key important parts and components, and then eliminating them, pruning them out, and replacing them with new functioning parts. That is not too different from what I'm suggesting we do even in our management of our health as we age. So unlike in an airplane, we don't necessarily always have perfect replacement parts on the shelf, but we do have stem cells. And because we have stem cells, and those stem cells, as long as they're healthy, can come in and they can replace the cells which are old, senescent, dying, etc., we have, in fact, kind of a set of replacement parts we can use. And so one of the things I'm really excited about is creating kind of a cadence, kind of a sequence of approaches where we enhance the removal and elimination and clearance of the non-functioning components of our tissues and organs, the cells that have gone senescent, and replacing them with healthy new cells, in many cases, the ones that we can bring there in the form of new stem cells. Now, you have stem cells in your body, which is fantastic, and those stem cells will do the job, but we're even approaching a point where we can augment that reservoir of stem cells in your body by giving you new stem cells, and in our case, at Cellularity, those new stem cells come from the placenta. So, I want you to think about the concept that as we age, some of our parts wear out. It's better to clean out those parts as they're wearing out before they fail. And if you do that in a proactive way, you can prevent some of the symptoms and consequences of diseases that are increasing in frequency in the aging population. The other thing, too, is that by clearing those senescent cells, there's no doubt you don't allow abnormal cells to go on to become a cancer, to become so abnormal and so transformed that they create the threat of you developing a malignancy or a cancer. So clearing senescent cells has lots of benefits. Maintaining performance and function is obviously one. Reducing the risk of these cells going on to become really abnormal and becoming cancer, and then simultaneously eliminating any of the secreted factors from those senescent cells which cause things like inflammation. So let's talk about that for a minute. One of the other bad things about senescent cells is they create something called a SASP. Now, SASP, S-A-S-P, stands for senescence-associated secreted proteins. These are products of the synthetic apparatus of the abnormal cell that are chemicals which signal or stimulate the process of inflammation. So it's becoming increasingly aware to the scientific and medical communities that these senescence-associated secreted proteins may propagate, may initiate, propagate, and fuel the inflammatory process, which gives us symptoms of pain and makes function even more impaired over time. Now, inflammation, as you know, has a lot of negative effects, including driving changes to the blood supply and the lymphatic drainage of tissues. All of those things lead to symptoms which we all kind of have to learn to live with as we age. But if you can prevent it by enhancing the clearance of senescent cells, that's good for everybody. And so we're excited about the prospects of being able to use cell therapy to enhance and drive the senolytic process and the seno-ablation process. And then we want to follow up after clearing and pruning. We want to follow up by introducing new healthy stem cells, which can help repopulate the tissues and organs and return them to a state of function, at the high state of function that we all aspire to have. So in the world of longevity medicine, in the world of preservation of human performance, I want you all to consider that one of the greatest tools to use to enhance the quality of your organs and tissues as you age is this seno-ablation, senolytic process, which is naturally driven by natural killer cells. And these natural killer cells are already in the clinic today being developed for a whole host of clinical conditions. And one of the things we're working on very aggressively is to make these seno-ablation tools in the form of cell therapies made of natural killer cells. We're driving to bring this into patients, measure the benefits that they can afford, and then drive them to the point that we can deploy them like any other therapeutic tool during our lifetimes. Another important concept to keep in mind is that the accumulation or the process of becoming a senescent cell takes time. It's potentially measurable, and it's measurable in a way that we can get a lens on just how old we are biologically. So let me try and explain that. Senescence is driven by changes in the ability of a cell to divide and the ability of a cell to make the normal repertoire or array of proteins that are encoded in our DNA. And so as we begin to age and accumulate these changes, there are new diagnostic tools that are available to measure this. And they're called aging clocks. Some of these aging clocks look at things like the methylation or the chemical modification of our DNA, our biological software. Some of these methods look at the erosion of the telomere on the end of the genetic material, that little protective covering that prevents DNA from unraveling. And some of these things are the accumulated changes that impair our ability to read the genetic code, translate it into proteins, and then secrete those proteins for different functions. All of these things impact your performance of your tissues and organs and your quality of health. So anything we can do to prevent, delay, or reverse those senescence-associated processes should have benefits to your health as you age. Now, to wrap this all up so that we all can understand it and put it to use, I want you to be thinking about the fact that as we age, as we live our lives and are navigating across temporary illnesses, injuries, and so on, think about it that some of the damage you're doing to your cells and your tissues and your organs is slow and cumulative, but is potentially addressable using this unique seno-ablation approach. So I'm personally very excited about the fact that I believe seno-ablation is going to be an approach we use to clear out the old senescent cells, what sometimes are referred to as the zombie cells, to make room for the new regenerating cells coming from your own stem cell population or from the population of cells you may receive as a therapeutic. And that over time, we can actually measure the changes in your organs and tissues by monitoring the number of senescent cells, making certain that we optimize the quality of your tissues by reducing the relative ratio of those cells, and always maintaining the health and integrity of your stem population, or if that's not possible, enhancing your stem population by giving you stem cells as a therapeutic tool. The whole process of cellular senescence is measurable. It's a way of actually assessing the quality of your health as you age. There are new tools like the aging measurement tools available from Tally Health. My friend Melanie Goldie and her team there, having the ability to kind of monitor what's happening to the health of your individual cells in every tissue and organ, and enhancing the ways we can clear it. And we'll talk later about ways to maybe delay or prevent cells from becoming senescent, maybe with nutritional or other measures. But we're in an era now where all of these technologies are becoming more widely available. As you maintain your vigilance on your health, doing whatever you can to reduce the senescent cell burden is going to benefit your health. And if we have a way to measure your biological age using some of these unique tools, that may drive some of your efforts to enhance the seno-ablation or senolytic process, and may drive some of your decisions about nutrition, may drive some of your decisions about exercise, supplements, etc. We'll keep you informed about this. I promise that on subsequent episodes, we're going to talk more about cellular senescence and the ways we're addressing it with natural killer cells and other tools. We're going to talk more about other strategies to slow or delay the process of cellular senescence. And most importantly, we're going to show you ways to take advantage of the technologies that are being developed at companies in the field of longevity, including cellularity and Fountain Life. So thanks again for joining me. This is Dr. Bob Hariri from Piloting Health, and looking forward to seeing you soon.